My name is, as I was introduced, my name is Bahae Samhan. I'm from Washington State University. This is my second year doctoral program. I haven't passed comps yet, so we're looking forward to do that in the summer. I'm along with Majid Dadgar. He's also a second year PhD student, and our advisor, Katie Josh, couldn't make it, and I'm going to be presenting on her behalf. Our paper is on mobile health information technology and patient care. We're going to look into the methods, themes, and research gaps. This paper was a result of our first doctoral seminar, and we were first introduced to the MHIT concept. I come from a computer science and telecom background, so I was a little bit more technical, and then we got into these concepts of MHIT in this seminar, and we generated a paper that was published at APSIS. We presented August 2013 in Chicago, and that's where we met Dr. Han, and he got us talking about this idea. So we got motivated to establish another paper. That paper was talking about only the themes and the methods in the field, and then we looked into the research gaps in this paper. So as we know, HRT is an emerging phenomenon. Everybody now in the healthcare industry are looking more from the technology rather than looking into productivity and efficiency of each technology. They're looking into what can we do with this technology to have care or quality of care to our patients. Another motivation is that MHIT, and this is from Chatterjee 2009, has been used in the industry more than it's been researched. So we always say that it's been lagged behind in industry, but actually it's been used. And in actual fact, there are a lot of evidence of using this technology, but it's way under research, especially in the IS literature. So this is our goal to investigate and look at the research gaps there. So the research objectives. So from our first paper that we presented at APSIS, which was Dadgar et al., he's sitting right there, to examine the extant literature and to understand the role of MHIT in providing healthcare to patients. So we're looking basically at themes and methods in that. In this paper, we're going to analyze the findings and manifest the research gaps in each theme. So our process was based on the intersectionality of these three areas. We looked into mobile, healthcare, and IT or IS. The intersectionality is mobile health information technology. So, and this is the most relevant papers that we found. So we'll find this is the area of the most relevant papers. The ones, for instance, that talked about mobility and IT, that was basically technical papers, had nothing to do with health information. So we excluded those out of our research. Some papers talked about mobile and healthcare, but didn't involve too much technology. So an example for that, maybe somebody would wonder how is mobile and healthcare with no technology? That mobile was defined differently. So some papers were talking about mobile as having a van that has some medical care that will provide to rural areas. And they mentioned the word mobile, so that one pop up on our search. The fourth area would be the healthcare and IT, but it didn't talk about the mobile side. And usually those are a little bit older papers, like technology was not so into mobile papers. So I'm going to let Majid talk about the literature process, and we'll take it from there.
This flow chart gives a big picture of the literature process that we did, of how rigorous the process was. So if Bob can click on it, we can just go through the flow chart very quickly to see the steps. So first, as he was saying, like we set the objectives for our research, which was reviewing the literature in the mobile health IT and the patient care outcome. What's the relationship? Also, examining the external literature for that. So we did the literature search. For the literature search, we had some boundaries. The boundaries was the mobile was, as he said, mobile was defined different ways, like mobile LANs, network, wireless networks. And also, we looked into the paper up to 2012. And also, we just searched the papers in the major journals in IT and IS, and also conferences. And also, you can see the list of the databases that we have used to try to cover the papers in medical field and also IS and IT. So we did the literature search. We used these keywords: mobile, healthcare, information technology, information system, and patient care, and in the field options of title and abstract. result of papers, we categorized them in we grouped them in three categories. The first category, as he said, that was the central intersection, was the intersection of the three areas. That was those papers were the most relevant papers, and the second area was healthcare and IT and IS. The third category was irrelevant papers, which were the papers that were about mobile and IT and not healthcare. And then we tried to explain and interpret those papers in the the first two categories, the relevant papers. So that you can see the first step and the second step. The first step is summarize the papers based on research questions, findings, methodologies we had, and then try to interpret and explain them. For example, which method has been used, how, to what extent it has addressed the objectives that we had in the research. And then we synthesized them, clustered them based on the phenomena, theoretical perspectives, methodology, and the findings. That also helped us to uncover the emergent themes in the papers regarding to mobile health IT, and also we developed a manuscript based on that. So if you go back to the presentation. So the next one is the outcomes. The outcomes for the first paper that we presented the access was that we understood the current status of MHIT in the literature, and also the role of MHIT on patient care delivery. And also the emergent theme. We uncovered the emergent theme. We're going to talk about them in the next slide. In this paper, we analyzed the themes to understand what is the research gap. So we did research gap analysis, and also so we developed a future research agenda for the future research of mobile healthcare IT. So if we get to the themes section of the presentation, before we uncover, before we see what themes are there, we just analyzed we ran a word cloud on the abstracts of the paper after we removed the key terms, just to get a sense of what themes can be, what the emergent themes can be. So as you can see here, some of these are now themes too, like privacy, monitoring, and use communication. So these are also themes. So just give us a sense of what's going on with the themes, of what the emergent themes can be. This table shows the emergent themes. We identified and covered 9 themes in our paper, and they are mobile use, HIT, communication, patient health, health and data, system integration, HIT success, HIT value, mobile health delivery, patient monitoring, patient workflow, and also privacy security. And that table shows the description of each thing as well as each thing in the paper. It should be in the paper. So, and also we identified the methods that have been using that are using the themes. So this table shows the description of the methods that have been used. For example, design science, secondary archival data, conceptual up to multi-method, and also immersed in the qualitative study, we merge interviews and case-based studies into qualitative study. And you can this table is also in the paper, so you can see the description of the methods. This table shows the themes by methods. So what methods are using what themes? So based on that, future researchers can see what are the methods, what methods can be used in other themes, or what are the if the methods, if the number of methods that are used in one theme is enough for that theme. For example, qualitative study, qualitative method. Those are the columns, and these are the themes. For example, qualitative study, probably researchers should use it more because they can interview with the patients and to get a sense of what's going on, what concerns they have, what needs they have regarding the privacy and security of their data that are going mobile. It gives a scope of the methods in the themes. So this is the first theme, build use HIT. It's about design, implementation, and adoption and use of information system technologies in the healthcare setting. For example, using HIT to examine the delivery of high quality with lower cost. And the research gap is that limited research has been done on the direct effect of HIT on patient care outcomes. Next, also, there is no evidence that was conducted to investigate the impact of healthcare technologies on patient care, as I mentioned. The second theme is communications. It's about the flow of information and communication between the patients and health professionals. For example, how mobile technologies can enhance the quality of interaction between the health professionals and patients. And the research gap is that there is a gap between use of MHIT and also communication. So more research can be done at the intersection of use and both use theme and communication theme to measure the effect of mobile health technologies. This third theme is health data and system integration. This has focused on integration-friendly infrastructure and MHIT in terms of use, cost, and scalability. For example, the effects of promoting integration-friendly infrastructure and the use of MHIT. As we know that in a hospital there are different wards and different departments, so they have different views on the information on patients' data. So how can we have a system that will support the integrated infrastructure for that data? And the data integration issues and the direct impact is also as well under research. The fourth theme is initiative success. It's about the success and failure of information system in healthcare. For example, what are the key factors of the failure of the information system or technologies in healthcare? And again, more research is needed to be done to provide key factors of technology success in the healthcare, especially using use of mobile technologies in that regard.
And it's interesting that we noticed that most of the papers in the HIT failure case studies were not done in the US. They were either in Europe or in Canada. So we didn't find any papers that would talk about the failure. Why would the HIT fail in the US? So that's also a research gap.
It's just about the benefits and values of the using HIT or mobile health IT in the healthcare. For example, what are the financial outcomes? Is it cost efficient? Is it time consuming? The research gap was more research should be done to highlight the effect of mobile health technologies and the values and benefits that they have for the patient and the patient care outcomes.
Yeah, so we're trying to divide the presentation to get bored. So the sixth theme is the mobile health delivery, and this is the one that we mentioned that where they actually would take a physical mobile, either a van or any type of vehicle that would go to rural areas to support or provide medical health. The research gap here is, go next, please. Yeah, so we found that very little or limited work has been done, especially on understanding the communication such as patients in the rural area or low-income neighborhoods. How most of the papers were, first, the number of papers were limited, and second, the type of technology being used in those mobile, I would say, vehicles is not very clear. I mean, they would just say that we provided the technology, nobody knows what type of technology has been provided there.
So under research area is that how mobile technologies can enable mobile physical vehicles to deliver care to the rural areas or low-income neighborhoods. So that was under research.
So patient monitoring, and in this theme, we combined the papers that looked into how technology would help in remotely monitoring elderly people or people with chronic diseases, diabetics, or even people with seizures. The research gap here was that we didn't see any paper that talked about the balancing between having as today we've seen in the Cisco presentation when they mentioned we have FaceTime doctor visits and then we have the actual face-to-face visit. So, and from what I've heard that they're limiting the time for 6 minutes now per patient if you have the mobile ability to communicate with your doctor. So no studies was balancing between the face-to-face doctor visit and using a mobile, say Skype or FaceTime visit with the doctor.
So it was mentioned that mobile technologies are reducing the number of hours that patients are visiting doctors face-to-face. And that is affecting the trust between the patient and the doctor's physicians. So none of the papers studied that, the balance between these two. And also the consequences of those.
In the long term, how engagement are they going to be? How willingly are they? Like patients engaging as we see in the first presentation, engaging before adoption, and wanted to see how engaged these patients are going to be. And none of those papers were talking about that. Which is the continuous use, which can be the second side of TAM, the technology adaptation model. So it's not only use, it's the continuous use, how continuous you're going to be.
Yeah, I guess Dr. Tan also mentioned it's more cross-sectional rather than being longitudinal. So it needs to be done more longitudinal studies.
So the eighth theme was the patient workflow, and these papers were looking into how technology would facilitate the patient workflow in a healthcare provider organization. And the research gap was that none of these papers, or very few of those papers to be accurate, talked about the mobile side of the workflow of technology. So the last theme was the privacy, security, patient data. And this probably is the most important one because privacy is a huge issue in healthcare, especially that we have now electronic records. So all of the papers that dealt with the EPRs, electronic patient records, and security issues for the systems being deployed in organizations were included in this paper. The research gap was that we didn't see the actual impact of having the records mobile on devices on the patients. So I'm pretty sure that once mobile kicks in into technology, you're going to have more security threats and more privacy issues coming up.
So we have TAM models for adoption, but what is the resistance? How about the resistance by the physician? At AMSIS, we were questioning is the most important thing that why doctors are resistant technologies. So we're thinking probably privacy is one of the areas that we can research. Maybe privacy is one of the antecedents that is affecting the resistance. So that could be a very interesting area to be researched.
And it's always nice to see that as we have a technology adoption model, why don't we have a technology resistance model? And I think that's a huge area of research. Why do people resist these technologies? So our finding concludes that the intersectionality of mobile healthcare and IT is the actual common area of research gap. And that's interesting because that's the area of the most relevant papers. So the most relevant papers still had the most research gap.
So that's the common research gap. Patient-centered care, MHIT.
Okay. So in our future agenda, we encourage scholars to look into interdisciplinary research because just working in IS field or just medical field is not happening. Yesterday at the dinner time, I liked Dr. Han's way when he said that we married two colleges, right? So I think we should do that. We should marry two disciplines to find research for these gaps or to add these gaps. So we noticed that few teams have fully embraced. For instance, I guess patient monitoring was one of them. It embraced the intersectionality of all three of them, but most of those teams have not, and they have huge gaps in research.
So it's just privacy security.
Yeah. So we call on ICE researchers to design and conduct research into intersectionality in order to address that gap. I guess we're done. Thank you. If you have any questions.
Can you tell me, I don't know if I missed it, did you articulate the databases that you were searching?
Yeah.
Yeah, it was in the research flow, literature search flow.
So do you want to go
okay.
back?
Medline, and for example, medical papers, and also top.
So did you explore like databases like PsycInfo, ERIC, and those types of things?
No, that was like one of the boundaries. So it was limited to the major top journals, IS and IT journals, and local medical journals. So
IS and IT journal?
Yeah, so that was like a boundary for.
Oh,
Yeah.
IS and IT.
Yeah.
And medical.
And medical.
Yeah.
Okay, so.
To see the intersection of those areas.
And that's part of our limitation. We put that in our boundaries that we didn't look into the other disciplines or the more general, because we looked at the only, we call it basket of 8 in the IS.
Yeah.
So
Okay.
those are that.
So what would you say that you would want to do from this point forward with this? How would you expand it?
Well, I know,
Yourself.
should I talk on your behalf? Okay, I know that Majid would like, for his dissertation, he's going to be looking into these themes and he's going to be addressing the research gaps in each one. We do a 3-paper dissertation system, so he might do three themes.
Well, we have several ideas. For example, from this conference, I had an idea, because my background is like design, industrial design, like designing devices, designing like interactive systems, user experience. So an idea that I got from this conference is that how can we design engaging, intuitive mobile devices or like healthcare system for the patients, and that's the part that can just play a role. So that could be probably my dissertation or research paper.
I would recommend that you explore some other databases too. You were interested in understanding the resistance, and you're going to find that in psych-info database. There's a lot about technology in healthcare, about physician, about clinician, user acceptance, efficacy, all of that, feasibility and everything. And then also, did you explore the human factors databases at all?
HCI, for example,
Yeah.
or computer interaction.
Yeah.
We'll use some major databases, right? Those main databases, I think, will be more ISIT, top ISIT. So
I'm just giving Microsoft some comment. I think that you have a good foundation, and I think that there's some other databases there that will actually be very complementary, and you're going to find out some answers to those questions.
And actually, this is something that we were discussing, and that's why we put it in the boundaries, because we figured out that we missed some of those, because it's probably not fair to just say bluntly that this is not found.
So,
So
ISIT scholars, what is happening if they want to research? So what is the current status of it in the ISIT information system, MIS management information system? What is the status of mobile health IT? But as you're saying, we can expand it to the other areas as well. That would be very interesting.
If you're doing health and IT,
Yes.
you've got to have a little
Yes.
bit more. Simul's not going to do it for you,
Yes. Yes.
and for the HIT part, it's
Yeah.
not going to do very well.
Yeah.
But you get into, like I said, sites for the
Yeah.
web of science, you're going to be able to get a lot more there.
That's true.
And I would recommend take a dabble in it.
Okay.
Any other
Thank you.
questions?
I think to piggyback on that, we're starting to see reviews that say they just went to Google Scholars. And one of you think of including the AIS library as well?
AIS?
ASL, or I don't know how to pronounce it, AISEL?
Yeah, I guess it should be in the database. So we use EBSCO
Okay, is it up?
no,
or the
No?
No.
it's not included in me, or
AISEL has got a lot of proceedings in there that aren't open access.
okay.
So,
Yeah, they have.
and most of what you're hitting though, you're wanting the cutting edge, that's gonna be in proceedings, it's not gonna be in journals, because journals take, especially those top journals, 2 to 3 to 4 year
Takes a
review
little longer.
process.
Actually,
That's-
that's in ISIS, there's a mini track of healthcare. We found several papers on that, so we're going to include them.
You look at HICS,
ISIS,
ISIS, and then go into HIMSS,
Yeah.
lots of proceedings papers.
I know
Well, also,
GSI
and then also, there's a lot of good information in health affairs too.
Yeah.
Speak to this as well.
Overall,
India, EMEA,
Yeah.
all those,
EMEA.
yeah.
Yeah, and then so,
AMIA.
AMIA and AMIA, AMIA and ANIA.
So one of the other ideas that I have is like meta-analysis. So if I'm going to do meta-analysis, it's definitely going to be like dissertations, practice-based papers, so I'm going to include all of them.
Well, you'd even include gray literature.
Yeah, exactly.
exactly.
I'll publish like data or, like practice-based data sets or studies.
Yeah. I think this can make a really good paper if you bring those other sources in and if you do that, then I think it'll be probably get that to at least the journal. Maybe communications
Yeah.
of AIS.
All right, any other questions, concerns, comments? All right. Please make sure you fill out evaluation form.